Hello, and welcome to the Pediatric Nursing Journal podcast series. This series provides extended content relating to articles published in the journal, such as author interviews and roundtable discussions. Before we get started, we have a special offer for our listeners. You can save 50% off 1- and 2-year subscriptions to Pediatric Nursing. Simply visit pediatricnursing.net, click subscribe, and enter PEDSAVE50 to take advantage of this special discount. In this episode, Mr. Micah Saviet, a social worker in clinical practice, a researcher, and the director of Springer Institute in Cheverly, Maryland, interviews Ms. Arlen Gaines and Ms. Meredith Polsky, both social workers and experts in child psychology concerning grief and loss. Ms. Gaines and Ms. Polsky are the co-authors of the award-winning children's book series, I Have a Question About. Their latest book, I Have a Question About Coronavirus, was published in 2020 and is available as a free downloadable ebook at ihaveaquestionbook.com. During their conversation with Mr. Saviet, Ms. Gaines and Ms. Polsky discuss their new book and how parents, caregivers, and children can manage coronavirus and navigate the challenging transition of schools beginning to reopen. Selected transcripts from this podcast episode are published in the July-August issue of Pediatric Nursing. We are pleased to present Mr. Saviet's interview with Ms. Gaines and Ms. Polsky.
This is your fourth book in your award-winning series. What originally inspired you both to write these books?
So this is Arlen. So first of all, Micah, thanks so much for meeting with us. We're really happy to meet you and always happy to meet someone who's graduated from the Maryland School of Social Work because I'm part of that group. So nice to meet you. Our interest in working with kids around grief and death and loss started many, many years ago. I'm a hospice social worker and now a hospice clinical manager, and I was in the field for many years and really saw that many of the adult children of my patients had a child at home with special needs and had been struggling with how to support them and how to find good books for them. And it really became apparent there was a real lack of literature on death and dying that approached this subject in a very direct manner. Very often we try to cushion children from difficult topics by using euphemisms or animals as subjects or characters in books. And I was really finding that there were children who just wanted the facts, were really craving concrete answers, and really acknowledging that there are some things that have answers and some things that don't, and that's okay too. So I had this dream of writing a book on death that was inclusive of all kids, including kids with learning differences, with autism spectrum disorder, and I felt like I could really bring that expertise around grief and that part of the subject matter, but I soon realized I needed a partner, and I approached Meredith. I've known her for many years, and she has her background in special education and social work, and she was a perfect partner. So Meredith, I'll turn it over to you from there.
Sure. So Arlen gave a really good background about why we set out to write a book about grief and loss, specifically with kids with special needs in mind. And I was really excited when Arlen approached me. It wasn't really something I had given a lot of thought to be honest, but all of my work had really been centered around sort of that nexus of clinical social work and special education, or social work in general and special education. And so what she was saying was making a lot of sense to me in terms of different people processing information in different ways. And this whole idea that not only do children with different types of needs process and understand grief and other things, differently, but also that there's this tendency among adults to not just shield them, as Arlen said, but also really to not have the conversations with them at all. Maybe there's an assumption that they're not going to be able to relate to it or they're not going to understand it, and so they're sort of passed over. And so I saw this, Arlen described it as a really significant need and a gap that we could really fill. We really had only planned on writing I Have a Question About Death. Like Arlen said, this was her passion. She's a hospice social worker, and that was our goal. And we were thrilled to have found a publisher that was interested in publishing that book. When we did publish the book, we started hearing from a lot of people that were nicely really grateful for the book, which we so appreciated. And they were also saying, death isn't the only really challenging topic that we need to talk to our kids about. So we really started thinking about this as the start of a journey rather than just one book. We listened to what people were telling us. We took experience from our own lives and what we saw people going through, and we decided that we would try to fill this void of talking to children with special needs about challenging topics. And so, of course, death was the first one. We went on to write I Have a Question About Divorce, and then I Have a Question About Cancer. When the pandemic started, Arlen and I started to have a conversation about what we could contribute to this brand new world that we all found ourselves in.
Well, thank you both. Appreciate that. Transitioning over to I Have a Question About Coronavirus. So this book is available on your website, open access for anyone to freely download in English, Spanish, and Greek. And I was just curious if you could speak to the decision behind making it freely downloadable for anyone.
When the pandemic started and schools were closing, I think like a lot of people, and certainly, people in our field of social work or mental health, it was really heavily weighing on our minds, how people and children in particular were going to navigate this brand new world that we were suddenly thrust into. Even back in March of 2020 when it was, schools were going to close for 2 weeks and it was unclear what was going to happen. But what was really clear was that there were all these terms and ideas and concerns that nobody had ever heard about or talked about before, right? When we think back to we were hearing flattening the curve, and we were hearing about quarantining, we were hearing about social distancing, which now is more referred to as physical distancing. And it just felt very overwhelming. And I think Arlen and I were both, among so many other people out there, we're both really concerned and really worried about how people were going to process all of this. Arlen and I started talking, and we realized that we had a really strong template for helping people navigate difficult situations, right? And that template was our book. And all three of our books, all four now, are structured very similarly, right? They're very much from the perspective of a child going through something, and they really take that child through a process of asking questions that many children would have in those various circumstances, and helping them, as Arlen said earlier, helping them understand that some questions have answers and some questions don't, and that too is really difficult to contend with when our questions don't have an answer. We wanted to put something out into the world during those early months. So many different people from so many different walks of life were just trying to do whatever they could to support one another and whatever skills they could put out into the world. And Arlen and I felt like this was our skill. We could potentially help families navigate something that nobody's really ever had to navigate before. First of all, publishing a hardcover book, as our others are, takes about a year. So that felt like it was off the table, for many reasons. So we wanted to get something out quickly, and we didn't want any perception of creating a moneymaker from a pandemic, right? Not that our books are moneymakers. I don't mean to imply that, but we didn't want to put something out that we would be selling. We really wanted to put something out that could just add value to the world in which we all found ourselves. And so we spoke with our publisher, and we're really grateful because they didn't have to say yes, but they really gave us their blessing and said that we could use our I Have a Question platform to create what we wanted in the form of a free download. We put it together really quickly, certainly much more quickly than our other books. And I think we were able to do that for a couple of reasons. First of all, there was this real sense of urgency. Second of all, because, we had experience with the format and sort of the template of how our books address challenging topics. But I think the other reason was that, and you'll see the coronavirus book is really for all children. And even though our books are really, we sort of dedicate them and have in mind children with special needs and disabilities, including autism and other challenges, we felt that for coronavirus, This is something that nobody had ever encountered before. And so it really created somewhat of a level playing field in terms of needing to understand things that nobody had ever needed to understand or grapple with. So we decided to write the story in a very similar way to our other books, with the understanding that these are questions that all children are going to have, and these are the types of answers that all children are going to need as we face something, again, that we've just never faced before. Arlen has children of her own. I have children of my own. We are surrounded by our communities and school friends and things like that. So the other reason we were able to write it quickly was because we were surrounded by children who were asking questions. We didn't have to go far to research and find out and really dig into, like for our other books, what are the questions that children are asking? What do they really want to know? Those questions were so out there, because everything was so new. Not that it was easy, but it felt like, okay, we have a really good sense of what the questions are. Now we need to figure out how to frame the answers. You noted, Micah, that the books are translated into a few different languages on the free download, and that also was something that came about through the kindness of strangers, which was really amazing because we felt that we put out this free resource in our book, and other people really came forward to sort of like pay that kindness forward. And people from different communities came to us and said, this would be incredibly beneficial to my community. What would you think if I translated your whole book and be able to use it, and also you would be able to post it in other languages? And so we are really grateful for that. These are not people we've ever met in person. We've only spoken to them through the course of them translating our books, and so we're really grateful that we can offer it as a resource in a few different languages because of them.
This is Arlen, and I'll just echo what Meredith said, that in addition to our professional backgrounds, we were living this just like everyone else, as moms, just parents trying to navigate this as well. And one thing that's really important to note in this book is we approached it not as the public health experts. We really have encouraged people, turn to the scientists, turn to the doctors on the medical side of this. But what we brought to it is our experience around supporting children and families around times of loss and change and transition and the tremendous uncertainty that those times can bring. And if we think back to a year from now, just the anxiety, the uncertainty, it was a very scary time. We tapped into that side of things and didn't put this out as the public health experts about the actual virus.
Yeah, thank you both. Yeah, which I think is a really important perspective, and that you even referenced in there. Listen to the experts. We're waiting for the scientists to give us new information and data. Kind of leads me into my next question, but I just want to back that for a second. I was just curious if you've gotten any requests to translate the book into any other languages.
The coronavirus book specifically?
Yeah, because I noticed you said some community members came forward, which I think is amazing, and I was curious if anyone's...
So the only other one I can think of that people were asking for was Hebrew, but we didn't have anybody to be able to translate it. The truth is, it takes a tremendous amount of time to translate a book, and so it's not something we really sought after and went and requested of people. It was really people who sort of decided on their own that this was something they wanted to take on.
Yeah, very time-consuming, and we learned that there are some words that we use that those words didn't exist in some other languages, and so we really worked with the translators because they wanted to make sure they were conveying the right sentiment. And we appreciated their careful and thoughtful efforts around the translation. So it was an interesting experience.
Yeah.
Thank you for sharing. Just kind of going into what you're talking about, letting the experts give us the information and speak. The CDC recently released updated guidelines for COVID prevention K-12 schools. Among the recommendations includes revised physical distancing recommendations, 3 to 6 feet, no longer recommendations for physical barriers in classrooms. We've all had a lot of flexibility throughout this past year as experts give us new information and are telling us new things and recommendations. What advice do either of you have for children and their families who are worried about this new reality changing as they're going back to school?
This is Arlen. I'm happy to start on that. And as we mentioned before, of course, we always defer to the CDC and the scientists and physicians for guidance. We really focus on the feelings that families and children have. And there is tremendous anxiety on all sides, some anxiety from parents, anxiety from children. So what we like to think about is how can we best support children and families around these feelings, and thinking about what strategies can be helpful, and we're happy to address some specific strategies, but really opening up those lines of communication in the way that fits for the child. So making sure that they feel like they can share what's happening using honest, clear language, circling back and talking about things again, because we know people kind of parcel out information because children process little bits at a time. We really want to keep those lines of communication open during this time of transition when some kids are going back.
And I think also, and this goes towards the strategy piece that Arlen alluded to, but really helping children, sharing information with them about the things we do know and the things that we don't know. So I think one of the challenges for kids who are returning to in-person school is that there's this image in their mind that they're going back to school. It's going to look like how it looked the last time they were in school. And for the most part, that's really not the case. The more we can sort of get a picture of what the classroom is going to look like, what the school is going to look like, what their day is going to look like, the more information we can give them sort of really concretely about what to expect, I think that helps to decrease the anxiety somewhat, while also recognizing, like you said, Micah, it's an ever-changing situation. And so they might get used to one thing or expect one thing, and then it changes. I know one of the real challenges, across the country, probably across the world, is it used to be that you wake up in the morning, and if it's, Tuesday, Wednesday, you're going to school. You get up, you eat breakfast, you get dressed, you go to the bus. And now kids wake up in the morning, and they honestly don't know if it's a school day, if it's a hybrid, if it's a virtual day, if their pod has had to quarantine, if some kids are going back to school, but they have to stay home for 2 weeks. And so much of what we do is in the vein of preparing kids for what to expect. And part of the challenge right now is that we can only prepare them to an extent, because things do change so frequently, and that's what we need to work on with children too, is around that flexibility and what to do when things don't go how we planned.
Wonderful. That's a very important point. Keeping flexible and being able to adapt and change as things change. Easier said than done, I think, for many of us.
Yeah.
So you mentioned some specific strategies. Just wanted to kind of open it up. If you have any others that you might be able to share with families and caregivers to help kids and themselves as they're going back to school.
So I'm a big fan of visuals. So helping kids know what to expect through visual schedules, visual cues, things like that. It doesn't have to be anything fancy. It could be stick figures. It could be Google Images, things like that. But helping children process, not just through words, but through visuals as well, having something they can refer to. They don't have to continuously ask the adult in their house, things that they can reference on their own to develop some of that self-sufficiency and resilience. We always talk about sensory kinds of things. For some children, we know that there are strategies that have been employed throughout different parts of their lives that have helped make their life easier. We really want to remember those things when we are dealing with new challenges or new transitions as well. So whether it's a quiet corner in the home that they can retreat to and gather themselves, whether it's a fidget tool or a weighted blanket or any variety of things that helps them to regulate from a sensory perspective, we want to remember that those are all things that are really important right now as well. We want to also remember that for many children with special needs and many children in general, there are support people in their lives other than their immediate family members. So some may have, a mental health therapist, some might have a speech therapist, an occupational therapist, all kinds of different people in their lives. And we want to whatever extent possible, involve those people in how we're helping to prepare our children, because everybody comes at these challenges from a different perspective. And we want to remember that each of the professionals in a child's life has strategies that hopefully have proven to be successful for that child in coping with different things. We really want to remember to think about who the child's team is and to help bring those people together as we think about what will be best for the individual child.
And I would add that whenever we're thinking about the best ways we can support children and teens, I always give a reminder that we need to also support the parents and caregivers. Parents and caregivers really will be better able to support these children as they're caring for themselves. And that's so easy to just say, but especially now as the weather's turning nicer. I'm looking out my window now and I'm seeing the trees starting to look a little green and just thinking about what helps parents and caregivers, some fresh air, taking a walk, taking breaks. The more they're caring for themselves, the more they can be supporting the children in their lives.
That's a really good point. Also, the point you made, Meredith, it's not all up to the parent. It doesn't all fall back on the parents or caregivers to help these kids through it. There's multiple professionals involved in our disciplinary team, whoever the kids have helping them already, have strategies and approaches for that they already know help these children.
Mm-hmm. Yeah. And I think that speaks towards the healthcare piece too, right? Like parents, I think, have felt very isolated, very alone in some situations, and even giving ourselves the reminder that there are other people who can help support us is really important.
I'll just add one point overall. I'm not sure if it answers this question directly, but this is the hospice social worker side of me talking. But I think when we step back and we look at what this year has meant, there has been so much grief and loss. We think about, okay, this is a time of a disease, a pandemic, but it has been so much grief and loss, changes in routine. People have died, changes in work situations, financial situations for many families. From A to Z, life has changed for many, many people. So that's a lot to process and a lot of loss in many different ways, loss of seeing friends, loss of being able to travel or do activities that you've enjoyed. I think, and Meredith touched on this before, though many children are starting to go back, it's sort of a little bit of normal, but not normal. So it's a very unique time, and I think we can't talk about this pandemic time without talking about loss.
Yeah, that's really important. Thank you for bringing that up. I recognize that children and their families have a wide range of emotions about returning back to school, and some kids may be feeling excited, and also others, like we talked about, nervous and scared. Mm-hmm. I just was wondering if you had any advice that could speak to how to cope with the range of feelings and emotions.
I think the first thing is to really pay attention to what your child might be feeling. Some children are really good at labeling and expressing their emotions, and some children will express it in other ways. And I think we need to remember that behavior is communication, and that we really need to think about the ways in which our children are acting and not just decide, oh, they're just being challenging or things like that. I think we really need to think about what might be behind those behaviors. Sometimes we see developmental regressions among children. So I think we need to pay really close attention to what might be going on with our kids, even when they're not easily able to express or label their feelings or emotions. And I think we need to remember that it's okay to ask our children questions about how they're feeling and really listen to their answers, not make assumptions about what they might be feeling or what they might not be feeling, and to recognize that those emotions are going to fluctuate, and that's okay. For parents who feel that their children's responses or emotions are not within normal limits, where they're, not interested in anything they used to be interested in, not motivated for schoolwork or to leave the house or things like that, then we really want parents to consider seeking outside help for depression or anxiety or, a host of other things. We need to listen to our kids, not just through their words, but through what they're showing us as well, and really be present for them and try to talk through with them what they may be feeling and how we may be able to support them.
Yeah, and I think, as Meredith talked about before, just thinking about what has been comforting to them in other challenging times and really tap into those tried and true strategies. Some children just need a break, some space, some physical activity, looking at what has been helpful in the past and really bolster that support.
I think fits in a little bit to what you guys were just speaking to. What signs or cues might parents and caregivers notice in their children that they might need to involve a therapist for additional support or guidance?
Children who have lost interest in things that they were previously interested in, children who are really having a hard time motivating to attend classes or get schoolwork done or leave the house at all, children who are really retreating, not interacting much with the members of their household, excessive crying or excessive moodiness, mood swings, things like that, in addition to certainly any indications that a child is planning to hurt themselves or says anything about wanting to hurt themselves or others. Of course, those are all things that people should seek immediate counsel on.
Thank you. I was just curious, have you gotten any feedback from children, caregivers, or their families about this current book, I Have a Question About Coronavirus?
We've gotten a lot of positive feedback, people who were really grateful that it was a resource that we put out. We heard from school principals who did like a read aloud of it over Zoom or YouTube early on. We got a lot of requests from teachers, therapists, principals from around the country for them to do read alouds, which of course was great. And, we were happy for them to do that. And I think people felt like not only was it a helpful resource, but also helped open up a conversation with their children and gave them sort of a structure in which to talk to their kids about what was happening in the world. That's been really gratifying for us.
I would agree. This is Arlen, and this book, it really went global. We heard feedback from corners of the world. I think at one point, deep into the pandemic, we looked up our book on Google, and we were just sort of shocked at the corners it had found. And it did feel good to be able to make a difference and provide a resource. We're in it just like everyone else. We're living through this as well. And so we feel like it's a little piece that we could contribute to during this time.
Wonderful. You may not be thinking about this now at all, but I just wanted to see if you had any next idea in your series for your next book.
We have a long list of requests that people have made, but we don't have any solid current plans for what we might do next.
We're always happy to hear ideas. People can visit our website. We have a little comment box and always are happy for feedback and ideas, but there seems to be an endless need for support around difficult life transitions, and there's so many different topics, so we shall see.
Wonderful. Thank you so much for taking the time, and I'm looking forward to getting this message out.
Oh, thanks so much. We enjoyed the conversation.
Thank you.
The Pediatric Nursing Journal podcast series is owned and produced by Genetti Publications Incorporated, all rights reserved. No portion of this podcast may be used without written permission. Mr. Micah Saviet is a social worker in clinical practice, a researcher, and the director of Springer Institute in Cheverly, Maryland. Ms. Arlen Gaines is a clinical manager with Jewish Social Service Agency Hospice in Rockville, Maryland. From her years in the field as a hospice social worker, she developed a specialization in supporting children and adults with special needs around grief and loss. She holds a Master's of Social Work degree with a specialization in aging and has an advanced certification in hospice and palliative social work. Ms. Meredith Polsky founded Matan online at matankids.org in 2000 and serves as Matan's National Director of Institutes and Training, as well as a child and family therapist and selective mutism specialist at Arbit Counseling in Washington, D.C. She holds master's degrees in special education and in clinical social work, as well as a graduate certificate in early intervention. The award-winning I Have a Question About children's book series includes I Have a Question About Death, I Have a Question About Divorce, I Have a Question About Cancer, and I Have a Question About Coronavirus, and are published by Jessica Kingsley Publishers. The book, I Have a Question About Coronavirus, is available as a free downloadable ebook. Visit ihaveaquestionbook.org for more information and to download your free copy. Selected transcripts from this podcast episode are published in the July-August issue of Pediatric Nursing. For archived episodes of this podcast and to learn more about pediatric nursing, visit the journal's website at pediatricnursing.net. You can also subscribe to the Pediatric Nursing Journal podcast series on Apple Podcasts, Google Podcasts, Spotify, Stitcher, TuneIn Radio, our hosting site Spreaker, and everywhere you get your podcasts. And remember, as a listener, you can save 50% off a 1- or 2-year subscription to Pediatric Nursing. Simply visit pediatricnursing.net Click subscribe and enter PED Save 50 to take advantage of this special discount.